Hi, I want to talk to you about tummy tucks today. I have just seen my patient who I performed her mummy makeover approximately 3 weeks ago, and she had 4 kilos of tissue removed from her tummy and a bit of liposuction and then bringing her in. And I can't tell you how amazing the result is. And she told me that she cried when she saw it. She was so over the moon. I remember when she came in, how nervous she was. I remember how she said how much she hated her tummy, how much she couldn't stand to look at herself in the mirror. And it is so gratifying for me to see how pleased she is, how more confident she is. Now, a tummy tuck, I think, is a pretty bad name because it suggests that it's a tiny little operation and it's done quickly and it's over in no time. And I don't think that's really a genuine description of what the operation is like. A full tummy tuck, and as it's known in medical circles, abdominoplasty. That just means reshaping of the abdominal area. Now, a standard tummy tuck is a cut from hip to hip, and then that will lift all of the skin up right up to here, right up to just where you feel the apex of your rib bone. And then we can bring the layers together underneath using a big permanent stitch, and that's what gives you that beautiful shape. That really tends to emphasize the end result. And then all of the skin is removed from the navel down towards a low-lying scar in the pubic area. And things are sewn up with 3 layers of stitches, and I don't use any drains because we've advanced our knowledge of tummy tucks, and now what we do is spare a layer of fat that lies underneath, and that mops up all of the fluid that we used to get, because you used to have drains in for 10 days and used to have risk of these collections known as seromas, but I don't see any of that anymore. I use all dissolving stitches, and then we usually put a compression garment on. That just helps to support you. I generally see people healed in about 10 days. There can be some small minor issues of wound healing. They tend to settle very quickly, but the results can be amazing, and there is no other way of achieving the sort of shape that I've got for this lady today. Now, there are variations on the tummy tuck. One of them is the mini tummy tuck. Now, that does kind of deserve that name because it is a much, much smaller operation, but it's really only suitable for you if you have that little bit of fatty tissue just below your navel. If you've got a bit of skin there that you can grab, and no matter what you do working out, you can't get rid of it, then a mini tummy tuck may be the answer. And that's a much shorter scar, a much shorter recovery time, and people tend to be very, very pleased with the results of that too. Now, if things are really, really bad, and now that means maybe massive weight loss, or you've just got an enormous amount of laxity from side to side as well, then the answer to that may be something known as a Fleur De Lis. And that comes from that shape of, the 3 petals, because as well as that a huge amount of skin being removed below the umbilicus, we then have a big petal that is removed from the upper part of the abdomen, and that helps to bring everything together on the side, just like bringing your jacket together like I'm doing now. Now, that's a much more extensive procedure, and that's only really if there's a huge amount of laxity there. But other than that, the procedure is exactly the same. Now, the results from tummy tucks are uniformly excellent. The healing is good and the satisfaction is high. So if it's something that you're interested in, then please do get in touch. We're all about safe surgery and happy patients here. Take care.